Dr. Arun Shah, Director of Neurosciences at Sir H.N. Reliance Foundation Hospital. Today, we are going to discuss a common condition known as migraine, also known as migraine headache. It's a primary headache disorder, meaning thereby the headache itself is a disease and there is no other cause of headache. It's one of the commonest disabling headache and affects more women than men. It is common in one of six women will develop migraine headache, while 1 in 11 children will develop migraine headache, and in men it is common as 1 in 16 men may develop migraine headache. Now, the cause of this headache is not understood, but appears that genetic factors as well as environmental factors play a part, and there are various trigger factors which trigger this headache in a person who is prone to develop migraine headaches. The commonest trigger factors are remaining hungry or fasting, stress, irregular sleeping hours, hormonal changes, bright sunlight, and abnormal smell and sound. The person with migraine headache, the brain is very sensitive and it reacts to all these triggers and induces the headache. Migraine headaches are of two varieties. One is migraine headache with a common migraine and migraine with aura. The aura is a migraine where there is associated other neurological symptoms, the commonest of them being the visual scintillations or visual blurring, wherein a person sees visual phenomena, blurring of vision, and in the bright light he sees some sort of clouds or bright lights going through. And after the scintillations or aura go away, they develop migraine headache. Rarely, migraine can have other auras such as sensory symptoms, tingling numbness of one side of body, and at times you can have vertigo, also what is known as vertiginous migraine. The diagnosis of migraine is basically based on clinical history, and the criteria are laid down that anybody who has episodic headache lasting for about 4 hours or so, throbbing in nature, either affects one side of the brain or at rarely it can be holocranial, more often unilateral, and is associated with sonophobia, that is sensitivity to sound, and photophobia, that is sensitivity to light. So a person during the migraine headaches wants to avoid bright light, wants to avoid loud sound, and prefers to go to a room which is dark and which are soundproof. So if you have such headaches going on for many months or years, then or more than 6 months, then a diagnosis of migraine is made by clinical criteria. The investigations are rarely required for the diagnosis of migraine, and generally they are done basically to rule out associated conditions, such as if the person with migraine headache may have some different kind of headaches and may have tumor and MRI may be required, but this is very rarely done and it is suspected on the clinical grounds, then only it is done. Now, when migraine diagnosis is done, then probably the treatment part. Treatment part of migraine consists of two things. One is during the acute attack, what one can do. So of course there are drugs which are used for acute attacks, and group of drugs known as simple analgesics such as paracetamol may work, or at times you have to give specific drugs. That is non-steroidal anti-inflammatory drugs such as naproxen works, and at times one can use drugs such as triptans, sumatriptan, rizatriptan, and some of the common triptan which are prescribed. Of course, important thing to remember is triptans have to be used as early as possible. As soon as the headache starts, if you use it, then maybe the headache will be prevented. Now, if you are delayed in taking a medication, then better to take NSAID or paracetamol, which will probably work better than triptans. Apart from the acute attack treatment, if you have more frequent headaches, and what I mean by more frequent is if you get about 4 episodes of headache in a month, which means you are almost wasting 4 to 5 days a month, then you require what is known as preventive treatment. And there are various preventive drugs, common drugs which are being used, the drugs such as propranolol blood, which is used for hypertension, that is drug which is sometimes used. The second group of drugs we use is tricyclic mood elevators, which is the commonest drug which is prescribed is amitriptyline. And sometimes we use drugs such as antiepileptic, such as sodium valproate is one of the common drugs used, or topiramate in people. So according to their comorbid conditions, such as whether the stress is triggering, they probably would like to use amitriptyline. If the person is overweight, then we tend to use topiramate. So we choose the preventive drug as per the associated comorbid conditions. However, most important part in treatment of migraine is that the person with migraine brain is very sensitive, and to have a stress-free life. So adequate sleep, stress-free life or yogas may help. Sometimes avoid bright light, to use glare when you go out in sun. Avoid funny scent which is precipitating. At times certain foods also can be precipitants or triggers, and that should be avoided, such as cheese or Chinese oil. People are so prone to develop, or some people are prone to have migraine headaches because of fermented food. So if you have any of this history, then probably it is better to avoid those kind of foods. Also, hormonal pills on the women are known to be a trigger factor, and maybe contraceptives use of different character, different variety will be better in women with migraine. So such migraine is a disease which is disabling disease, but can be managed very well with the modern day treatment. So there are new the chemicals which are underlying migraine are of course serotonin, and the new chemical discovery has been CGRP or calcitonin gene related protein. So there are new treatments are based on modulating the CGRP, and monoclonal antibodies to CGRP are another new form of treatment which is available, which consists of giving monthly injections, and probably that will prevent headaches, and these are given subcutaneously self-administered every month, and you can get rid of people who have other therapies are failed. This kind of therapy helps them also. So person with migraine can have a normal healthy life with whatever treatment which are available as of today. Thank you.